Hello.
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 Yes, sir.
Okay.
Yeah, yes, sir.
Just continue that one. Open treatment. Physician surgically opens the fracture site by making an incision. Next. Key terms are
Sir, once repeat it.
physician.
Sir, once repeat that.
Yes. Physician opens the fracture site by making an incision. Key terms are placement of intramedullary nail or rod. Placement of intramedullary nail or rod. Next key term, ORIF. O-R-I-F. ORIF. Right? Open reduction, internal fixation. ORIF means open reduction, internal fixation. Open reduction, internal fixation. Open reduction, internal fixation. Next one, percutaneous treatment. The fracture site.
Can you repeat the what?
Yes.
Can you repeat key terms for open reduction, sir? Placement of intramedullary
Nail or rod. Next one is ORIF. O-R-I-F. ORIF. That means open reduction, internal fixation. Next one, percutaneous treatment. Fracture treatment which is neither open nor closed. In this treatment, the fracture site are not directly visualized by a physician. In this treatment, the fracture site is not directly visualized by a physician. Is not directly visualized by a physician. Is not directly visualized by a physician, but fixation of pins is placed across the fracture site. Fixation of pins is placed across the fracture site under X-ray imaging. Fixation of pins across the fracture site under X-ray imaging. Now listen here up to here. See, if a patient is having closed fracture, the physician will go for closed treatment. Patient is having closed fracture, he will go for closed treatment. My question understood, everyone? Patient is having
Yes,
closed
sir.
fracture, he will go for closed treatment. What is the first point I said? Type of fracture does not depends the type of treatment. That means what? It may be closed fracture. The physician go for open treatment. Based on the type of fracture, they will never decide the type of treatment. Always keep the first point in mind. By seeing the scenario you are having open fracture, physician may perform always open treatment? No. Understood everyone the first point? Type of fracture does not depends on the type of treatment, or you can say type of fracture will never decides the type of treatment. Next point. How many types of treatments are there? 3 types. What are the? Closed treatment, open treatment, percutaneous treatment. Physician will not use any instrument in closed treatment. Then how they will fix the fracture? By reduction. That means manipulation, or by application of force. That means traction. Whereas open treatment, they will use device and they can directly examine the fracture site, or the physician may place a nail or rod across the fracture site. Then this is nothing but open treatment. Then what is the use of percutaneous treatment? They will place nail pins across the fracture site with the help of guidance. Pins across the fracture site with the help of guidance is nothing but percutaneous treatment. Check everyone the definitions up to here. Any doubts you can ask me. Just check what you have written, everyone. See, always keep in mind, type of fracture does not have any correlation regarding type of treatment. Is that clear, everyone? Check your notes. Those 3 definitions understood? Geeta Kumar,
Yes, sir.
any doubts in those 3 definitions? One is
No, sir.
without opening the fracture site, one is with opening the fracture site, one is placement of pins across the fracture site with the help of guidance. Okay. Next point, write down. During fracture treatment, if physician use bone graft, or external fixation device, bone graft or external fixation device, bone graft or external fixation device, quote them separately when it is not listed or is not a part, when it is not listed or is a part, when it is not listed or it is a part, it is a part of a surgical procedure. is not a part of a surgical procedure or code description. Code description. Code description. C. We can code external fixation and bone graft separately. What is the rule? When it is not a part of the code description. Do you recall the age related guideline in anesthesia? If age is a part of the code description, do we code age separately in anesthesia?
No, sir.
No, like the same way here. If physician is using bone graft or external fixation during fracture treatment, code it separately. When it is not coded separately, if it is a part of the code description, do not code them separately. Next one. Next one. Initial application of cast, CAST cast. Initial application of cast and strapping are included in fracture treatment. 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 Next point. Reapplication or subsequent replacement of cast. Reapplication or subsequent replacement of cast or strapping. Subsequent replacement of cast or strapping can be coded separately. Can be coded separately. Can be coded separately. When we need to code cast or strapping, do we need to code initial treatment during initial treatment as per the rule?
No.
No. When we can code separately, reapplication. Second time, third time the visit, they are applying cast or splint or strapping, we can code them separately. Next one. Next rule. Excision of connective tissue tumors. Excision of connective tissue tumors. Excision of connective tissue tumors are based on excision of connective tissue tumors are based on first point, deepest layer second point, diameter. Deepest layer, second one is diameter. Deepest layer and diameter. Now can anyone tell me what are the deepest layers of the skin? What is the superficial layer of the skin? What is the superficial layer of the skin?
Epidermis.
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 Next layer.
Dermis.
Next
Dermis.
layer.
Hypodermis.
Subcutaneous.
Subcutaneous.
Next layer.
Muscle,
Muscle. Next layer.
fascia,
Fascia. Next layer.
bone.
Bone. When we are getting connective tissue tumors, we need to find out the deepest layer and diameter. Now just check the rules. First, if the type of fracture is there, you need to find out the type of treatment. Next point is, during fracture treatment, bone grafts, external fixation devices, if it is not a part, code them separately. Next one is, initial application of cast is a part of the procedure. These are the basic guidelines. Now see question number 25. Try to find out what type of treatment done by the physician. Who will explain me this question? Pravalika, can you explain me this question after doing question number 25?
The patient presented with
Yeah,
reversible fracture.
You can do first. You can explain me the answer.
Okay.
Completed, Pravalika?
Yes, sir.
What is the first point? What is the body part involved in fracture? What is the type of
Elbow
fracture?
humerus.
Elbow, supracondylar fracture of the elbow. Yes or no? No.
Yes, sir.
For now, 3 points always keep in mind. Is this any open fracture related terminology there? Open treatment, like making an incision, rods, nails, like that, any terminology in the question?
No, sir.
No. Any skeletal fixation? Placing pins across the fracture site under guidance?
KY.
Pins across the fracture site with the help of guidance, is there the statement?
No, sir.
No. Then it's an closed treatment. Now you can see. After conscious sedation, left upper extremity was trapped and closed reduction was performed, achieving anatomical reduction of the fracture site. The elbow was then trapped with the use of fluoroscopy guidance. Two K-wires were directed consisting the fracture site. Stable reduction was used. They bent. They are applying the traction, application of force. Understood? Now, what is your answer then?
24535.
What is your answer? 245? Tell the answers. Geeta Kumari, what is your answer?
Sir, 24, 535.
24535. Everyone? See, this is a closed treatment. Now try to see the terminology in the question. Is there any placement of nails, rods, open incision? No. Is there any placement of pins across the fracture site under guidance? No. Reduction means what? Manipulation. 24535. Understood everyone the question? Do one more question. Question number 29. Question number 29. Question number 29. Question number 29. Only those are the 5 rules in musculoskeletal system. Question number 29. Did I complete it for your respiratory system? For your batch? Respiratory system?
No, sir.
No.
No, sir.
Okay, okay. Then if I done with this, then 2 topics are remaining for you, respiratory and cardiovascular. Yes, Shobha, can you explain me the question? What is the treatment done?
Yes, sir. It is a closed treatment, sir. They are doing reduction and they are applying traction for the fracture.
Okay. Everyone in the class? Any other answers? Anyone is confused with open percutaneous closed by reading that question? Everyone in the class? Yes, what is your answer then?
24535, sir.
Everyone 24535. Someone coded 24538. Who is that? Susmita, why you coded 24538? May I know?
Sir, here pins are used.
See, with the help of pins, you are going for percutaneous treatment. Pins placed across the fracture site with the help of X-ray or with the help of imaging guidance through the skin. Again, see the
Okay,
definition.
sir.
Okay, across the fracture
Okay.
site through the skin with the help of guidance. Like that is the statement here? No. The pins,
No, sir.
they are placed on the strapping, the cloth which is tightly wrapped. They are using pins to hold it. Is that clear?
Okay, sir.
Okay. Take one more question. See question number 40. Question number 40. What is the type of treatment here? Open treatment, closed treatment, percutaneous treatment.
Open treatment, sir.
Open
Open treatment, sir.
Open treatment. Now, when we are discussing on Saturday, debridement is performed at here. What type of fracture? Open fracture. If you go back to your debridement session, 4 key terms: infected skin, necrotizing soft tissue, open fracture. Yes or no? Those who have attended the last session. Yes or no? We completed the topic or not? Then what will be the answer?
27506, sir.
27506. 11044 or 11012?
Checking, sir.
11012, sir.
11012.
Open.
Open fracture. Then what is your answer? B is the answer. Understood everyone?
B.
Is that clear? Like this, the key terms of intramedullary nail rodding will be there for open treatment. Do one more question. See, if you practice this paper, then you are good in a musculoskeletal system. When you are reading a question first time, it will be difficult for you because of unknown terminology. Read the question at least twice or thrice. Then it will be very easy for you. Question number 39. The last question. Then we will go into the codes. Question number 39.
Two double seven double two, sir. 39 answer. Answer B, Bombay.
What is the answer?
Answer B, Bombay.
Bombay. Everyone, 27722. C is the answer. Any questions? Any questions here?
No, sir.
Okay. Now come to the text.
Sir, it may be 27724, maybe so.
Read the code description.
The
277.
graft is obtained from the iliac crest.
Okay. Read the code description. 27724.
Repair of non-union or malunion tibia with iliac or other autograft.
27722.
Repair of non-union or malunion
Okay.
tibia with sliding graft.
With
Sliding graft.
sliding graft. 47-year-old patient was previously treated with external fixation. There is no non-union. Open reduction of tibia with bone grafting. Approximately 30 grams of harvested. The fracture site was. Then it is 27724 only. Why you people call it as sliding graft? Did they mention it as sliding graft? Understand?
But here mentioned tibia also.
Tibia.
With
Both are tibia only, right?
But the graft is harvested from the iliac.
Yes,
So we get quote from the iliac.
27724. 27724. Yes, Sunil. Why you coded 27722? Okay. Now go with the codes in your book. Page number 136. Page number 136. Are you there, everyone? Page number 136. Wound exploration. Are you there, everyone? Wound exploration. Page number 36.
okay, sir.
Okay. Now try to underline the first 6 lines in the wound exploration. Gunshot wound or stab wound. Foreign body ligation. Enlargement of wound. Extension. Coagulation. Minor subcutaneous or muscular blood vessels. All those cleaning. Underline the first 5-6 lines in that paragraph. Just write down body part. What we need to look for? Body part. Exploration is the key term. What we need to look for? Body part. Body part. Next. Come to the codes 20552, 553. 20552, 553. 552, 553. Just put shortcut there. TPI. Trigger point injection. 20552, 553. What is the key term? TPI. Trigger point injection. Based on number of muscles. Based on number of muscles. Based on number of muscles. TPI. Next. Mark the codes 20600 to 20611, 20600 20611, 20600 20611. Just write down there in the itself. Based on type of joint, based on type of joint, based on type of joint. Second point, with or without guidance. Based on type of joint. Second point, with or without guidance. With or without guidance. Based on type of joint. Second point, with or without guidance. With or without guidance. Now can you read the code description 20605? Anyone in the class? 20605. 20605.
Arthrosynthesis, aspiration and or injection, intermediate to joint or bursa without ultrasound guidance.
Without ultrasound guidance. What is the type of joint here? Intermediate joint. Example they have given in parenthesis. The information which is in parenthesis in the code description or below code description is very important. What are the intermediate joints? Temporomandibular joint, acromioclavicular, wrist, elbow and or ankle. Understood? Next, come to the code. I said external fixation devices. You can see the diagrammatic representations on my screen. Those are external fixation devices. In that, mark the code 20680. 20680. 20680. 20690. 20692. 20690. 20692. 692. 692. Now, can you read the code description 20690? 20690.
Application of a uniplane, pins or wires in one plane, unilateral external
You
fixation
can see the
system.
leg diagram. On only one side they placed a rod, that is uniplane. On both sides they placed the rods, that is multiplane. On only one side, it may be right or left. Both left side and right side, both sides, you can see this diagrammatic representation. This is nothing but multiplane. And this is nothing but uniplane. This is nothing but external fixation devices. 692 is for multiplane. Now see question number 28 and give me the answer. Question number 28 and give me the answer. '28. See what we need to find out. Deepest layer and diameter. Always keep in mind when you are getting any soft tissue tumors. What is the answer? Question number 28.
C.
What is the
23066.
what is the deepest layer here?
Shoulder.
What is the 23066? What is the code description? 23066.
It means deep, sir.
Deep. Okay.
Bioscopy.
Okay.
Biopsy soft tissue of shoulder area, deep.
Okay. 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 Come to the codes. 29,000 series. 29,000 series. 29,000 series. Page number 205. 205. 205. Are you there, everyone? 205.
Yes, sir.
Okay. Arthroscopy, visual examination of joint in the shoulder. Mark the important codes. 29806. Capsule repair. 29807. 807. 29826. 826. Those are the three important codes. And 29828, bicep tenodesis. Can everyone in the class, desis means? Desis means? Desis means
Binding.
binding or fusion. 29828. Next, come to the knee. 29880. 29880. See there, medial and lateral. And means both the compartments. Medial and lateral means both the compartments. 29880. 29881. Or any one of the compartment is involved, medial or lateral. 29882, 883. These four codes are very, very important. And means both, or means anyone. Always keep in mind. Now, take the questions and practice at home. Take the question numbers from Musco paper. See, in Musco paper, only 5 rules you need to understand. One is type of repair, that means type of fracture and type of treatment. Second point is regarding bone graft and external fixation. Third point is excision of tumors. You need to see the deepest layer and diameter. And fourth one is cast application. When we need to code it separately or not. Only there are 4 rules in total musculoskeletal system. Try to take the questions. Question number 14, 14, 16, 16, 19, 22, 22, 24. If it is 7, let me know. 24. Total how many I said as of now?
5.
5. 30, 30, 32. Complicate 7.
Yes, sir.
Yes, sir.
Yeah, these 7 questions practice at home. Then tomorrow we will start. Once I will discuss these 7 questions, then I will discuss you regarding respiratory system. Then one more. By Thursday, I will close your sessions. By Thursday. Today is Monday, right? Tomorrow respiratory system. 2 days cardiovascular system. By Thursday, we will close the course for your batch. Okay. Any questions?
Hi, sir.
Yes. What is your doubts?
Sir, in previous question for soft tissue 23066 is not mentioned in biopsy now. Why is coded 23066?
Okay, let me check. Question number 28, right?
26 or either 29.
What you
28.
coded? What you coded?
23075, sir.
What is that code description? Can you read? Can you read that code description? Hello, Sunil. Can you read that code description?
Excision tumor of soft tissue of shoulder area, subcutaneous less than 3 centimeters.
See, where is here soft tissue, tumor, and everything, Sunil? If you read the code description, painful mass. Mass means
Actually, it's asking for biopsy. In the code description, there is no biopsy word is mentioned. So he thought that there is no biopsy. Why you coded for biopsy?
see, with blunt deep dissection, the mass was removed means what? It's a biopsy only. Specimen was sent for pathological examination. It's not tumor directly removed. It's a specimen removed and sent for pathological examination. Understood?
Okay, sir.
Okay. Any questions?
Hello.
Yes.
Sir, in pathology question paper, 30 question, can you explain it, sir?
Everyone mark your doubts. From this Saturday onwards, every 1 hour I will take doubt discussion session for your batch. Question number 30, right?
Yes, sir.
See, there is general health panel is added. Okay. In
Yes, sir.
health panel, what they need to perform? Comprehensive metabolic panel and blood count.
Blood counts.
Metabolic panel and blood count.
Blood count.
Okay. But they didn't
Yes, sir.
perform the total comprehensive metabolic panel. What they performed? Except creatinine they performed, right?
Yes, sir.
Even one is missing, you cannot report a total panel code. You need to report separately.
Okay, sir.
Understood? CMP means
So I can,
yes.
so I can repeat the all
Yes, you need to
lab
code all.
tests are
You need to code all. You need to code all. Why?
okay, sir.
Because if creatinine is not performed, CMP means all they need to perform. CMP, CBC. Then only they perform general health panel. Then only they perform general health panel. Understood?
Yes, sir. Yes.
Okay. Thank you
Thank
everyone. Practice those 7 questions. We will.
Hi, sir.
Yes, Sunil.
Sir, in rational in 28 questions, C is given wrong.
C is given. I
Yes,
will
sir.
check.
23075 is given.
No issues. I will check by tomorrow, Sunil. Okay.
Okay, sir. Thank you, sir.